Welcome to DecodeMD, where we bring you real stories from doctors who live the journey every NEET PG aspirant dreams about. I'm your host, Dr. Pranav Joshi, and today we are decoding one of the most fascinating branches in modern medicine, MD Radiation Oncology. To help us understand this blend of clinical care, cutting edge technology, and compassion, we have with us today Dr. Tanay, who is junior resident in radiation oncology at Tata Memorial Hospital, Varanasi. So, without further ado, let us all welcome Dr. Tanay and let's decode radiation oncology. Welcome to Decode MD, Dr. Tanay. Great to have you here. फिर से.
Hello, thank you for having me. Yes.
Okay, so let me first break down the segments of today's podcast. So, segment 1 may will cover your journey. Segment 2 may will look after your residency life. Segment 3 may will talk about career scope and future prospects related to radiation oncology. Segment 4 may will talk about super speciality and pathways to abroad. Segment 5 may will talk about top institutes of radiation oncology in India. And segment 6 may will cover the myths related to your branch. Then at the very
Sure,
end, we'll have one rapid fire round. Okay?
sure.
Sure. So let's just quickly move on to our first segment, where we'll start from your story. So tell me, how did you decide to take up MD Radiation Oncology?
So during my internship, I got to know about this branch. Before that, I didn't know about this. And मुझे regular branches में नहीं जाना था. I wanted something new. My first preference was nuclear medicine. And after researching about nuclear medicine, I got to know more oncology related branches. And then I stumbled upon this branch, radiation oncology. I came to know about few aspects of it. I researched it and I liked it basically. And then I plan to take it after my result.
Okay. Okay. Where did you do your MBBS from?
My MBBS is from Maharashtra University of Health Sciences, Nashik, MUHS Nashik.
Okay. So radiation oncology is there in your UG college?
In GMC Nagpur, we have radiation oncology, but that's a old setup that we have in there.
Okay. Hello. Sorry. You got. You were not audible बीच में.
Acha, okay.
Okay.
So yeah, we have
So tell me what. Yeah. Continue, Dr. Tanay.
so we have a department in GMC Nagpur actually, and in that we have a older
Mm-hmm.
setup. Uh, we have a command machine there,
Okay.
so that's how it is.
Okay. Okay. So, what was your first impression of this branch before joining radiation oncology, and how have they changed since your since the residency began?
So, my first impression was that it has a slightly more work-life balance than other branches. Maybe it is a 9 to 5
Mm-hmm.
branch, but that perception में थोड़ा break हो गया after joining residency. So, not a 9 to 5 branch,
Uh-huh.
well work-life balance compared to other branches, but not 9 to 5. You may have work up to 12 also sometime, and you have emergencies also. So I didn't know that there were emergencies in
Okay.
this branch.
Okay. What made you choose radiation oncology over other oncology related branches like medicine, surgery?
So basically, we have only one oncology branch that we can get after NEET PG as a MD because the medical and surgical are
Uh-huh.
MCH and DM branches. So, so if you
Uh-huh.
have to get into oncology after your PG, this is the choice.
Uh-huh. Okay. If not this branch, what would have been your alternative and why?
Like I've said earlier, my first preference was nuclear medicine. It was a branch which
Uh-huh.
had a minimal uh, patient exposure, and other than that, maybe I would have taken up ENT and further planned my MCH on head oncology, head neck surgery. But that was a long way, so I
Okay.
had to cut this.
Uh-huh. So, since your internship only, you had made up your mind that you want to get into this branch, radiation
Yes,
oncology.
yes.
Oh, that is actually nice. बिकॉज नहीं तो यूजुअली ऐसे ही होता है कि लोग रेडिएशन ऑन्कोलॉजी बस ले लेते हैं कि मतलब इफ दे आर नॉट
हम्म,
गेटिंग अदर क्लिनिकल ब्रांचेस तो लोग प्रेफर कर लेते हैं बट इट इज़ रिफ्रेशिंग टू नो दैट पीपल आर जॉइनिंग रेडिएशन ऑन्कोलॉजी बिकॉज दे वांट टू जॉइन इट एक्चुअली
हाँ राइट, वैसा
है ना
होना चाहिए एक्चुअली।
हाँ तो
हम्म,
लेट्स एक्चुअली नॉट जस्ट विथ रेडिएशन ऑन्कोलॉजी बट विथ एवरी अदर
any
ब्रांचेस लोगों
branch.
को कोई भी ब्रांच बस इसीलिए लेनी चाहिए हाँ बिकॉज इफ दे आर जेन्युइनली इंटरेस्टेड इन अ ब्रांच देन ओनली दे शुड टेक अप दैट ब्रांच.
हाँ राइट.
Okay, let's move on to our another segment where we'll talk about your residency life. So tell me, what a typical day in your residency look like?
Okay, so before getting to know that, a resident may have been posted into three different categories. So he may be posted in OPD or a CT simulator where he has
Mm-hmm.
to do his CT scans, or a TPS, the treatment planning system, where he has to look after the patient setups on
Uh-huh.
machines and do the radiation plans, contouring, OARs, etc. So after knowing that, the day starts with our academic classes, which are daily, almost daily. And after our academics, the
Mm-hmm.
resident has to see the morning morning ward rounds. And after that, he has 9 to
Mm-hmm.
5 OPD if he is posted in OPD, or 9 to 5 he may be posted in one of the other two places that are. And after that, evening ward rounds. And in the evening, hello. And in the evening,
Uh-huh. I
everybody
can
has
hear it.
a common contouring and OAR and radiation planning work at our center.
Okay. Hello. Can you hear me?
Yes, yes. Okay.
Okay. So, how do you balance patient consultations, radiation planning, and treatment sessions?
So patient consultation happens between the OPD hours only. And
Huh.
during the OPD hours, we counsel our new patients about the what is radiation treatment, how it will affect your outcomes,
Uh-huh.
or if you don't get it, how will it affect
Hmm.
your recurrence, like that. Before the patient
Hmm.
is being
Huh.
started on radiation on the machine, we tell him that how he
Hmm.
has to lie in a specific position so that he doesn't move or the radiation doesn't hit any other areas, like that. We counsel him how to lie,
Hmm.
how will be the time of radiation, what will be the time of session of radiation, each session, how many days it will be, like that. And after that, in the evening,
Okay.
uh, after 5 p.m., we do our contouring sessions and planning work.
Okay. So, Dr. Tanay, many of us actually think कि this is a very machine heavy field, है ना? So,
Hmm.
how much real patient interactions do you have compared to the perception that one have about your branch?
So yes, it is a machine related branch, but the part that
Uh,
a doctor or resident has to see is purely patients, and the clinical decision making
Mhm.
is his or her part. So what we have to treat, how we have to treat, that is our decision. And the part related to the machines, the working of the operation of machines, is the part of technologies, or the commissioning of machine, the maintenance of machine, is the part of medical physicists that are part of our team. So we get to know the basics of the
Okay.
machines through our course. Like we have radiation physics as a topic of our exam. So we get to know the working of machine, working of
Uh-huh.
rays, the physical part of it. We know it, but the management is done by the physicist and the technologist. But yes, it is a
Okay,
machine
and
independent branch.
um, what skills and technologies you guys are trained in, like contouring, treatment planning, or even like operating the linear accelerator? Do you guys get your hands-on training in these things, or you just like read about it and there are assistants to manage the machines?
No, they are like the bread and butter. So we have to do it. Like we have to do everyday contouring. Contouring basically the selection and planning of the areas of treatment that we have to treat, and who has the organ at risk that we have to contour, that are the areas that need to be spared during the radiation treatment. So that is our everyday in and out thing that we have to do. And other than that, we have linear accelerators only at our center. So we get a very good
Uh-huh.
hands-on exposure. And also about the brachytherapy. We have brachytherapy 3 months, 6 months posting throughout the 3 months residency. And in that we
Mhm.
get hands-on on the brachytherapy techniques.
Okay, for our NEET PG aspirants who all are planning to join radiation oncology, what are the must have machines that they should inquire about before taking up radiation oncology in any college?
So one has to see the presence of a linear accelerator, a brachytherapy
Mm-hmm.
unit. So these two are the main basic things before joining or a decision of taking an institute.
Okay.
So any
So
high-end linear
then
accelerator and brachytherapy
next
are
would
the base.
okay, Dr. Tanay. How what would you say ki how research oriented is your department and what kind of studies are residents encouraged to take up?
So radiation oncology per se is a very highly research-oriented branch because it's a
Uh-huh.
cancer-related treatment. So ever-evolving branch it is. So we take up very
Mm-hmm.
rare case reports. We take up studies related to the hypofractionation of radiation treatment, for that reducing the
Uh,
dose and reducing the fractions, increasing the dose and minimizing the normal tissues.
mm-hmm.
So studies related to these concepts like that. Other than that, the molecular studies and
Okay.
chemo-related studies also.
Nice. So, okay, let's move on to another segment where we'll talk about the career scope and future prospects in your branch. So, once someone finishes MD Radiation Oncology, what are the career options in academic, private centers, or even like research-based roles? What are the options?
So after completion of MD, you can directly join the after 1 year of associate, you can directly join a corporate hospital as a junior consultant.
Uh-huh.
And other than that, you can complete your 3 years of associate and directly join as a consultant in any government center. Then there are fellowship
Okay,
opportunities after
nice.
completion of associate. So that those are the plus points
Uh-huh.
for getting job. And if you have to focus on any specific part that you have to improve. Also, there are some students who take DM. They do a secondary DM degree in medical oncology. So that is one thing that
Uh-huh.
students are currently doing. So currently in
Acha,
India, these are the
is there huh, correct, okay. Is there any fellowship options for other departments as well? Like, suppose if someone has done orthopedics, do they have is there any fellowship options available for them uh, to deal with like cancers related to bones?
like I don't have any idea that the different branch has a specific fellowship for oncology related things, because basically the treatment would include surgery or chemo radiation. So he or she has to refer such
Uh-huh.
cases. Maybe he can do the surgery part. Uh, yes, surgical
Uh-huh.
candidates can do fellowships, basically.
Okay. So now the most important part of our entire this conversation. How is the earning potential and job satisfaction compared to other clinical branches?
So earning potential is quite good. It can start anywhere between 1.5 to 2.5 lakhs as an initial junior consultant, and that is also dependent on which
Mm-hmm.
city you're working on. It is a tier 1 city, maybe you will get 1.5. If it is a very remote city, you may even hit up to 3.5. और कोई नॉर्मल सिटी जैसा है टायर 2 सिटी तो यू मे गेट अप टू मिनिमम 2 to 2.5 starting. Some departments are there where they don't
Okay.
have a radiation
And
department per se, and they need an oncologist. So they may hire
uh-huh.
you, and you will be the HOD there, that head of department. Right? So where there are opportunities, there is
Mm-hmm.
quite boom in radio.
Okay, the hospital that you're working in currently, like you are doing your residency from Tata Memorial Hospital, Varanasi, na? So,
Yes.
how would you describe your hospital? Is it a government hospital? Is it a private hospital, or like is it a trust-related hospital? What sort of hospital it is?
It actually is a trust-related hospital which comes under the government body of Department of Atomic Energy of India and
Okay.
trusted and funded by like Tata. So it
Okay.
comes
So,
under the government
how much
department.
stipend? Okay, it so you would say कि it is a government hospital only, right?
It's a government.
So, how much stipend do they pay you during your residency there,
In
if
residency in
you
Tata,
don't
we have,
mind?
yes, sir. So in hand, we get up to 1 lakh after all the cutting.
Okay, okay. That's actually a quite good amount. I mean, is it the same with in Tata Memorial Hospital across India, or is it there in Banaras only?
No, it's the same across all the Tata sectors.
Okay. Now let's move on to another question. Like with AI, proton therapy, and this precision radiotherapy growing fast, how do you see your field evolving in next decade?
So the AI is coming up in a big way. The part that we are doing
Hmm.
manually, the contouring of the organs at risk. So that may be automated by AI.
Uh-huh.
The AI may know what is heart, what is liver.
Uh-huh.
We will decide what to spare. AI
Hmm.
will contour it. If we tell him to spare heart, he may contour heart automatically.
Uh,
And that is the part of AI. That may
uh-huh.
be the part of AI. Other than that, what we have to treat, what is the radiation portal, what would be the areas that would be covered in the
Hmm.
radiation field, that would be decided and controlled by humans only. Because that part cannot be replicated by an AI, as per my opinion.
Uh,
And other than that, the precision oncology is
okay.
already in use. Actually, we practice precision oncology with our various techniques like VMAT, IGRT. Other than that, proton centers are
Uh-huh.
only two in India, in Mumbai and Chennai. So proton centers might
Hmm.
come up in various other centers in India in coming up few years.
Hmm. Okay, okay. So let's move on to fourth segment where we will discuss about super specialty options and pathways to abroad. So what are there? Are there any specific super specialty which caters to just radiation oncology, or do you have like any secondary DM options as well? Which
So as I've discussed earlier, if you have to focus on a specific site-specific oncology, for example, after your 3 years
uh-huh.
of MD, you have to see only head neck cancer patients. So you can do a fellowship on head neck oncology. You can then do an observership or fellowship in SRS, SBRT techniques or fellowship in brachytherapy to
Uh-huh.
focus on a specific part of the big picture. Or other than that, you can do a DM in medical oncology if you have to give another three
Mm-hmm.
years. So that is about India.
Okay.
And if
So
we have to talk about abroad,
Mhm.
so you can move to UK, US. even Australia, and there are multiple certification exams like lab and fellowship
Mm-hmm.
exams like
Mm.
FRCR that are well recognized and may give you a job in other countries.
Okay. Suppose if someone does FRCR, can like जैसे MRCP की eligibility होती है कि with right after MBBS and your internship you can apply for MRCP. So
Hmm.
is it the same requirement for FRCR as well, or the requirement varies with FRCR?
After MD, we can give an FRCR exam. Like after MD, we can give a secondary
Okay.
DNB as a secondary degree. So we can
हाँ
give
हाँ
similar वैसा
हाँ.
कि FRCR MD के बाद दे सकते हैं the three
Okay,
year.
तो as
हाँ.
हाँ. So having MD Radiation Oncology is a prerequisite to apply for FRCR,
Yes.
right? Okay. And what are the options if someone wants to go to Gulf countries?
In Gulf countries, I think there are the certain specific certification exams for that.
Okay,
I
okay.
don't
And
exactly have details for
how
the
does it?
Gulf side.
हाँ हाँ. It's okay. कोई नहीं. कोई नहीं, doctor. How does a career abroad in this field differ from the Indian setup in terms of workload, pay, or research exposure?
Okay. So in the other outer countries, the this branch as a branch
Hmm.
is well established. The centers are well established. There are
Mm-hmm.
machines in multiple city centers. While compared to India, it's
हाँ.
still an evolving branch. Although many centers have now linear accelerators, but still the medical
Mm-hmm.
colleges, older the centers have the older machines. Also, the number of hospitals per population is less. So, at a particular center, the patient load
हाँ.
will be quite high and the centers are
हाँ.
low. So, in certain parts of India, you may get a
Okay.
very high workload and high pay based on the
हाँ.
need. And in certain metropolitan
Mm-hmm.
cities, there might be oversaturation of a sort. While in abroad, there is quite a good pay compared to certain parts of or chunks of India.
हाँ. Okay. How does research exposure varies between let's say like in UK, US, and compared to India in radiation oncology?
So researches are happening in every like in every city, every country, every city, every center where radiation is
Mm-hmm.
practiced. About variation aspects of radiation, as I discussed, the hypofractionation, the dose dose in elevation, and all that. So multiple studies are already ongoing and
Okay.
uh, will be conducted in future.
Okay, nice. Let's move on to our fifth segment. We'll we'll talk about institutes and admission process. So for our NEET PG aspirants, what are the top institutes in India offering MD radiation oncology?
So top institutes includes the Tata Memorial Center, then AIMS
Hmm.
Delhi,
Hmm.
AIMS Gorakhpur, AIMS Raipur
Hmm.
also. So in Tata and AIMS, the departments are quite good. In GMCs, if you have to take it, first see the availability of linear accelerator, or even if they don't have linear accelerator, are they posting you somewhere where for some months where you can get the training of a linear accelerator? And other than that, the in South India, the Kidway Memorial Center in Bangalore. So that is a good center. Then in Uttar
Ah,
Pradesh, the SGPGI, Lucknow. So these are some
ah.
of the centers. The PGI, JIPMER. All these are premier institutes for radiation.
So all the top and premier institutes in India have radiation oncology as a branch with them,
Yes.
right? Okay. So how competitive is it to get a seat in these colleges for radiation oncology?
compared to earlier years, it's getting quite tough by each passing year.
Mm-hmm.
So maybe even a AIR of 10,000 you may find difficult to get in to TMC Mumbai through NEET.
Mm-hmm. Okay.
So competition is gradually increasing.
Okay. Nowadays people talk so much about saturation happening in all the branches. So how would you say, okay, what is the situation of saturation getting in radiation oncology?
So saturation is somewhat there in metropolitan cities for as a job
Mm-hmm.
prospect, and otherwise that there isn't much saturation right now. A freshly passed MD student can easily get a job in tier 2, even tier 1 cities. So they need
Uh-huh.
people, they need oncologists to run departments. So they have that kind
Uh-huh.
of shortage that there are no one to run departments only. So right now the saturation is
Okay.
very minimal, but it might increase very soon.
Uh-huh. Okay. So if you don't mind me asking, what was your NEET PG rank range and like counseling strategy before getting into this college and this branch?
Okay. So my AIR was around 15,000 in that time, 2 years back.
Uh-huh.
And
Mm-hmm.
the cutoff for Mumbai was around 10, 12,000, 10,000 something. And after that, my uh, second option was TMC Varanasi. So it's a branch of TMC
Mm-hmm.
Mumbai only, with similar working environment. So I took it up here, and I was
Mm-hmm.
getting here through All India quota.
Oh, nice. Okay, so what should aspirants consider when deciding between radiation medicine, radiation oncology, nuclear medicine, and radiology?
So all those similar sounding, these are completely like different branches. So if a student doesn't like much of a OPD work or patient interaction, he may choose
Mm-hmm.
radiology or nuclear medicine. So there isn't much difference in radiology and nuclear medicine. Nuclear medicine also is an imaging branch, mostly an imaging branch, not entirely.
Mm-hmm.
There is some sort of patient interaction related to the treatment of thyroid cancer, the radionuclear iodine therapy, and all that thing. And radiation
Mm-hmm.
oncology is a purely clinical. You have a long working OPD hours. You have to continuously interact with the patient, counsel them regarding the treatment outcomes, follow up those patients.
Mm-hmm.
So compared to radiology and nuclear medicine, this is a completely clinical branch. So before taking up this branch, if you are comfortable with a good amount of patient interaction, you can choose this branch.
Okay. Okay, so let's move on to our last segment, where we will talk about myths and mindset required in radiation oncology. So, first of all, what are the most common myths about radiation oncology that you have heard, both from the medicos and non-medicos?
Okay, so myths related to radiation oncology, the most common one that I've heard is ki, do we get radiation exposure while working? The female
Mm-hmm.
students and those ask ki, do we get radiation exposure? So no, we don't get radiation exposure as a doctor or resident because we don't stay near the machines 24 by 7. We stay in OPDs and our planning
Mm-hmm.
system, near our planning system, and we do the planning work and see the patient. Machines are run by the technologists
Uh-huh.
also, and the newer machines aren't dependent on the radioactive active source like cobalt 60. So there is no risk of radiation
Uh,
leak, for example, that thing. So no, there is no radiation risk. Other myths are
okay.
that some patient ask ki, how is it helping? We have done surgery. So cancer to nikal gaya. So how will
Uh,
radiation help? So we have to explain them ki there might be micro uh, mets or micro harboring of disease somewhere. So to prevent recurrence, we have to give them that. Patient also have doubts regarding secondary malignancy because of exposure to radiation sometimes. So we counsel them about this.
Uh-huh. That actually makes sense for patients to have this kind of doubts ना कि सर्जरी हो गई
Yes.
अब तो कहाँ से कैंसर बचेगा. Makes sense.
Uh,
Okay, so what kind of personality or mindset thrives in this specialty?
So you have to see oncology patients day in and day out. So as a doctor, you need
Uh,
to know that a cancer patient may have a 5 year survival of ranging from 10% to 90, even 90%. So there are patients who will relapse
mm-hmm,
after 1 year. There are patients who will relapse in months. There are patients who will relapse after 10
mm-hmm.
years. So you have to keep in mind that cancer can relapse anytime. You have to be emotionally strong and you have to counsel patients as such. And such kind of mindset should be kept while seeing a patient and while being in this branch. A positive attitude must be kept, and you must know that you are treating a very non-curable thing. You are giving life to a patient. You are alleviating their painful symptoms for whatever months they have. So that's the kind of attitude you have to keep.
Okay, like you said कि there can be relapses within months, within years और मतलब relapses रहेंगे. You have to be mentally prepared. So any layman would have this doubt कि अगर relapses रहेंगे ही and there is this huge risk of getting relapse anytime after getting radiotherapy. So why should they actually get radiotherapy?
Yes, because if you don't have radiation sometimes combined chemoradiotherapy, as we call it. So if you don't have it, you
Hmm.
may never have got free from disease only. There must be some micromets or must be some residual in you. So you are never cancer free. So
Mm-hmm.
this is a chance that you can actually get cancer free. And relapse is a specific risk you have to keep in mind because uh, the biology of cancer may not be fully understood till now. It's still evolving. So recurrences will be there. So it's a
Uh-huh.
matter of when actually. So if you don't get any treatment, you may have cancer and it may relapse within months, or you may extend it to up to years, 10 years, maybe.
Okay, so when do you call a patient cancer free actually? How do you define cancer free?
Yes. So for example, I will give example of a head neck patient. So for example, a patient of CA tongue,
Uh,
after we have primary treatment is
uh,
surgical excision of the tumor. After that, we give radiation and chemo as per
mhm,
indication. After completion of radiation, he follows at our OPD and we see
mhm,
him after 3 months. First, after first month for the assessment of
mhm.
toxicity of radiation, and after 3 months for his first assessment. So maybe after 3 to 4 months, if we don't have any clinical suspicion, we may do clinical examinations. We sometimes advise scans, MRI or PET scan for response evaluation. And in that, after 3 months, we
Uh,
call him cancer free. So after declaring cancer free after the 3 months, 4 months of treatment, we just keep him under follow-up for early detection of relapses,
mhm.
if any. So it's
Okay,
not like that he's
that
never
that actually
cancer.
sounds like a nice strategy. Uh, yes. Moving on, what's one life lesson this branch has taught you?
So the Francis taught me that life is very fragile actually, and the patients and their family, after they get to know that she has this sort of a disease, so the mental
Uh-huh.
uh, stress they have and the amount of stress they go through. So it's a thing to learn from them, ki how they manage those things, how they get
Mhm.
out of those things. The cancer treatments are very, very long. So how they keep their persistence to all. those hardships. So that's a very motivational thing that we get to learn from our own patients.
That that must be very encouraging also, actually. And so finally, what's your advice to NEET PG aspirants who are still unsure about choosing radiation oncology?
So before taking up this branch, first you see that you really interested by visiting the specific department at your nearest hospital that has radiation oncology. See the department, see the working
Mm-hmm.
24/7, talk to residents, and if you like it, then you take it. Just don't take it because you're getting at your rank.
Yes, actually, that is actually very good advice, Dr. Tanay. So let's move on to our very last segment of this podcast, rapid fire round. So, what is the one word to describe radiation oncology?
Ever evolving.
Nice. One thing you love most about your branch.
The technological aspects, actually, the actually sci-fi
Most
kind of thing.
underrated. Oh, okay, nice. Most underrated aspect of radiation oncology.
The awareness of it, actually, among the common
Good.
layman and also the doctors.
Mhm. Maybe people will get to know about radiation oncology after watching our podcast.
Yes.
So,
Mm.
if not a doctor,
Oh,
what would you be? If not a doctor, what would you be?
okay. Mostly mechanical engineer because I like machines and the
Okay,
working of
makes
it.
sense. That makes sense. That makes sense. Now, the dream innovation you wish to see in cancer treatment.
So all the cancer-related researches are directed towards minimizing treatment-related side effects and maximizing the precision of treatment and preventing the recurrences
Mm-hmm.
for as long as we can. So innovation is in the same lines only that no or minimal side effects. Sometimes current treatments are uh, uh, very much side effect. So minimal side effects and maybe a 10, 15 years of cancer free, like that, like long years of life
Uh-huh.
expectancy and a minimal involvement of
Okay.
AI,
That
maybe.
maybe we'll find out about that in next 4 to 5 years, I guess.
Yes.
You know. Okay. That was an incredible insight into your branch, Dr. Tanay. Thank you so much for sharing your journey, and
Thank you.
I
Thank you.
hope people and our aspirants will get to learn about this branch and they will get encouraged to join this branch. And we will ask our aspirants to write their queries in the comment section below so that uh, you or I can sort out their queries and help them move ahead in their future.
Yes, surely. Please feel free to comment in the comment
Thank
section and ask any doubts. You can reach Dr. Pranav or me.
Yes, yes. Thank you, Dr. Tanay. Thank you so much.
Thank you. Thank you very much.